Are Canada's hospitals on the brink? Join us as we uncover the critical shortage of staff plaguing the nation's healthcare system. How can Canada address the pressing staffing crisis in its hospitals to ensure quality care for patients? We delve into the alarming shortage of staff gripping the nation's healthcare facilities, with reports indicating that hospitals across the country are overwhelmed and understaffed. We turn to experts for insights into the root causes and potential solutions. Join us as we explore the challenges facing Canada's healthcare system and the urgent need for action to address this critical issue. Please remember to like, subscribe, and press the notification bell for future updates. Now, without any more delay, let's dive right into the video. The recent findings of a poll conducted in Ontario's healthcare sector have shed light on the significant staffing challenges faced by hospital workers in the province. This survey reveals that 41% of hospital employees express feelings of dread about going to work, with a similar proportion contemplating leaving their jobs altogether. These alarming statistics underscore the pressing need to address the underlying issues contributing to burnout and dissatisfaction among healthcare professionals. In this discussion, we delve into the implications of the survey results, explore the factors driving the staffing crisis, and consider potential solutions to alleviate the burden on Ontario's healthcare system. Overview of survey findings. The comprehensive survey conducted by Nano Research on behalf of the Ontario Council of Hospital Unions offers a panoramic view of the state of Ontario's healthcare system, with insights gleaned from the first-hand experiences of over 750 hospital workers across the province. At the heart of the survey lies a tapestry of narratives, each thread intricately woven to reveal the nuanced complexities of a workforce teetering on the brink of exhaustion and discontent. Central to the survey findings is the stark reality of burnout and dissatisfaction among hospital employees, encapsulated in the staggering statistic that 41% of respondents harbor feelings of dread when faced with the prospect of heading to work. This palpable sense of disillusionment underscores the profound toll exacted by the relentless demands of frontline healthcare roles, a burden further exacerbated by the tumultuous currents of staffing shortages that plague the sector. Indeed, the survey paints a vivid portrait of a workforce stretched to its limits, grappling with the Herculean task of meeting escalating patient volumes amid dwindling resources. The repercussions of these challenges reverberate through every corridor of Ontario's hospitals, manifesting in emergency room closures and protracted delays in essential medical treatments, a stark reminder of the precarious balance upon which the healthcare system teeters. Yet amidst the prevailing sense of despair, glimmers of resilience and determination emerge as healthcare professionals navigate through the turbulent waters of their chosen vocation. Emergency physician Dr. Kashif Prada, a beacon of insight in these tumultuous times, sheds light on the myriad pressures confronting hospital staff, particularly during peak periods when the demands of the job reach a fever pitch. Dr. Prada's reflections offer a poignant insight into the toll exacted by perpetual resource scarcities and the weighty decisions faced by frontline workers as they grapple with the delicate balance between patient care and institutional constraints. Moreover, his elucidation of the challenges in retaining newly graduated healthcare professionals, often lured away by the promise of less demanding roles, underscores the urgency of addressing systemic issues that undermine the sustainability of Ontario's healthcare workforce. In essence, the survey findings serve as a clarion call for action, a rallying cry for policymakers and stakeholders to heed the voices of frontline workers and embark on a journey toward comprehensive reforms. Only through concerted efforts to bolster support mechanisms and address systemic deficiencies can Ontario's healthcare system hope to weather the storm and emerge stronger on the other side. Analysis of staffing challenges. In the heart of Ontario's healthcare system lies a pressing staffing crisis, a tangled web woven from escalating patient numbers, constricted resources, and insufficient aid for those on the front lines. Dr. Kashif Prada, a seasoned emergency physician, navigates through the findings of a revealing survey, uncovering the immense burdens borne by hospital staff, especially during peak periods of demand. Dr. Prada vividly paints the picture of perpetual shortages, where frontline workers grapple with the weighty decisions of prioritizing care amidst limited resources, a struggle that amplifies feelings of desolation and burnout. Furthermore, he delves into the unsettling trend of fledgling healthcare professionals, fresh out of academia, fleeing for less strenuous roles mere months into their careers. These narratives shine a glaring light on the pressing need for holistic reforms and fortified support systems, essential elements to alleviate the relentless strain faced by Ontario's healthcare workforce and safeguard the cornerstone of quality patient care. Impact of COVID-19 on staffing shortages. The COVID-19 pandemic has intensified the already acute staffing shortages in Ontario's healthcare system, posing unparalleled challenges for frontline workers. Dr. Prada acknowledges the enduring impact of COVID-19 on the workload of hospital staff, characterizing it as a permanent escalation, especially during peak seasons when the flu and other respiratory illnesses overlap with the ongoing pandemic. This perpetual surge in demand for healthcare services strains an already stretched workforce. Despite the escalating demand, efforts to mitigate staffing shortages are impeded by capacity constraints and inadequate investment in urgent care clinics. Dr. Prada emphasizes the critical need to expand capacity and invest in urgent care clinics as viable solutions to alleviate staffing pressures. Urgent care clinics offer an alternative for patients with non-emergency conditions, relieving the burden on hospital emergency rooms and allowing frontline workers to focus on critical cases. However, the lack of investment in expanding these facilities undermines their potential to alleviate staffing shortages effectively. Furthermore, Dr. Prada highlights the cyclical nature of staffing shortages exacerbated by the ongoing pandemic. The increased workload and strain on frontline workers contribute to burnout and turnover, further exacerbating staffing challenges. Without robust measures to address these issues, the healthcare system risks entering a perpetual cycle of understaffing and strain. Addressing the root causes of staffing shortages requires a comprehensive approach that involves strategic investment in healthcare infrastructure, workforce development, and support systems for frontline workers. Dr. Prada underscores the urgency of these measures in ensuring the resilience and sustainability of Ontario's healthcare system in the face of ongoing challenges posed by the pandemic and other healthcare demands. The COVID-19 pandemic has exacerbated existing staffing shortages in Ontario's healthcare system, presenting unprecedented challenges for frontline workers. Dr. Prada emphasizes the need for strategic investment in urgent care clinics and other support systems to address these challenges effectively and safeguard the delivery of quality patient care. Government response and policy considerations. Amidst Ontario's healthcare crisis, questions surface regarding the government's efficacy in tackling staffing challenges. Dr. Prada's skepticism towards current interventions underscores the pressing need for more robust solutions. He references the Ontario Auditor General's proposal to bolster urgent care clinics, portraying them as vital lifelines akin to miniature emergency rooms. These clinics promise expedited care for patients with non-life-threatening conditions, potentially alleviating the strain on hospitals. Yet Dr. Prada emphasizes that merely expanding urgent care clinics won't suffice. He advocates for substantial investments and concerted efforts to fortify the healthcare infrastructure comprehensively. By addressing systemic issues contributing to staffing shortages, such as inadequate resources and support systems, Ontario can foster a more resilient and sustainable healthcare system. Dr. Prada's insights shed light on the intricate challenges facing Ontario's healthcare sector. Despite the allure of quick-fix solutions, he underscores the necessity of holistic strategies that prioritize long-term sustainability over short-term fixes. Only through concerted efforts and strategic investments can Ontario hope to navigate its healthcare crisis and ensure quality care for all residents. In essence, Dr. Prada's critique serves as a call to action for policymakers and stakeholders to reevaluate current approaches and prioritize initiatives that address the root causes of staffing challenges in Ontario's healthcare system. Conclusion: the findings of the survey underscore the urgent need for action to address the staffing crisis in Ontario's healthcare system. As hospital workers continue to grapple with burnout and dissatisfaction, policymakers and stakeholders must prioritize investments in workforce support and capacity expansion. By implementing targeted interventions, such as the expansion of urgent care clinics and increased funding for frontline services, Ontario can mitigate the strain on its healthcare system and ensure quality care for all residents. Remember to subscribe to our channel and click the bell icon to receive notifications for new videos. Take care and farewell until next time.